Hi, hello. Today, let's discuss an interesting case of carotid space lesion. This lesion was predominantly T2 hyperintense with central T2 hypointense areas. In fact, it was anteriorly displacing carotid vessels. It was compressing on the IJV. So, this is the lesion which you are seeing, and the lesion wasn't showing any diffusion restriction. Or in T1, the lesion was predominantly hypointense. The post contrast was surprising in this case. Lesion is literally non-enhancing. There is peripheral enhancement and central necrosis. All these are classical features of a schwannoma with a chronicity, or also called ancient schwannoma. In fact, if you carefully see on sagittal weighted imaging, it is almost looking like an abscess, but this is a biopsy proven case of schwannoma. So you should always be aware that sometimes schwannoma may not show the typical enhancement pattern or target appearance or type of enhancement. When it is long standing, when there is predominance of Anton A cells, there can be a lot of degeneration. We can call this as cystic schwannoma. In fact, if you carefully see, it is tracking all the way into the skull base, most probably proving the etiology that's a Vagal Schwannoma. It is a dumbbell shape with predominant dumbbell below the skull base. Fiesta sequence, thin slices to appreciate the foraminal extension of the lesion. See this foraminal extension. This is a classical case of ancient schwannoma. Incidentally, patient also had CT scan was performed. The patient didn't have any calcification. Again, the widening of the foramina was very well seen on the coronal image. Ultimately, in this case, the take-home points are: how will you differentiate a vagal schwannoma from a carotid bud? These are poorly enhancing lesions, schwannomas, compared to the paragangliomas. So the T1 weighted, they will be isointense to the muscle. T2, they will be hyperintense to the adjacent muscle. Then there will be heterogeneous enhancement pattern. This will show very different pattern of enhancement. Ancient vagal schwannoma will show distinctive features. Pericystic enhancement. It looks like a complex cystic mass. There will be very heterogeneous enhancement pattern. There will be degenerative changes, sometimes at the capsule. Marked heterogeneity, cystic areas, pericystic enhancement, sometimes blood products or calcifications may be present. If it is in a small peripheral schwannoma, you'll see this Tinel's. Unlike carotid body tumor, where you'll see this typical splaying appearance. In our case, if you would have seen, it was more of an anterior displacement of carotid vessels was seen rather than a splaying. So, which is very classically seen in paraganglioma, which is also called layer sign. In our case, the jugular vein was compressed and it was separately visualized. And, you'll see this typical salt and pepper in a paraganglioma, not in schwannoma. These pathognomic findings, and this pepper is mainly the flavoids, and hyperintensities are the salt appearance. There will be intense post contrast analysis. It's a very important radiological teaching point: vagal schwannoma versus carotid body tumor, bifurcation and parapharyngeal space. So in our case, it was predominantly in parapharyngeal space, and it was showing heterogeneous enhancement pattern. Actually, vagal schwannoma separate. These are my references. Hope it was useful for you. Thank you very much.